As we're talking about the new patient experience today, one of the things that um, is potentially offensive to new patients, especially those that are in pain, is to arrive at our office and to be handed some paperwork to fill out. It's a necessary evil, but I think that the experience could be made a little more pleasant, um, and possibly a little bit more efficient as well for certain patients. The thought is that we can fill out most of that information for them and then capture or get their signature at the appropriate time. There definitely will be instances where the paperwork is really kind of a time killer to allow us to um, get something else done, but I really think that the standard procedure really ought to be for us to fill that information out for them to a certain degree, and then enter that information into eaglesoft. When I come in on the weekends, that's exactly what I do, and it's a function of efficiency. I can get things filled out much more quickly than to hand them that and then to sit around and wait for them to fill that out. So I just wanted to go over that really quickly as far as how to fill that out. Um, so we've got a new patient here. Ideally, their information would have already been entered, but let's assume that it hasn't. But some of this information should be collected on the phone. And we got Jack Johnson, and his preferred name is Joe. One of the things that you may or may not be aware of is you don't really have to capitalize things in eaglesoft. It will actually take care of all the capitalization for you. And so this information, especially the phone number, should have been entered beforehand, and their name. When they get here, it ought to be very easy to recognize, okay, this is a person we don't know, they're showing up about this time. Hey, it's nice to meet you, I'm Aaron, I spoke with you on the phone. You must be Jack, is that right? Okay. Well, let me get a little information from you, and we'll get you right back, Mr. Johnson. Now tell me what your address is. Type that in there real quick. Do you have a work telephone number? How about a cell phone? Okay. And the marital status is, something a little bit awkward to ask people about that. But if this asks if they've got dental insurance, are you going to be using that? Again, that's something we should already know. Your dental insurance company will want to know these things. What's your marital status? Most people are very happy to give these things out. What's your birth date? What's your social security number? Again, a little explanation as to why you're asking that's good. In this day and age, people get a little bit worried about protecting those things as far as identity theft goes, and say, Joe, since we're going to be using your dental insurance generally uses your social security number as your ID number. So can I get that from you? And then insurance, again, do you have your insurance card, and put that in there for you. Now with the Trojan, I understand there's a little bit of confusion, but hopefully that'll get easier and easier as far as being able to pop those benefits in there. We just need to verify things. What's your email, Joe? Is it okay if we ever need to send you a note if we use your email? Yep. Okay. So I do all those things. And then the other thing that can be done is the medical history. So type that there. And Joe, are you seeing a doctor now for anything? No? Have you ever been hospitalized or had a major operation? Just go through and ask these things. No? Have you ever had a serious head or neck injury? Yes. Are you taking any medications? Yes. Do you have a list there that you want me just to put in? You just want to tell me what they're for? Okay, so just type in the medications that are there, and just go through and ask these things. Any type of special diet? Yes. Use tobacco? Yes. If they indicate that they use tobacco, would you like to quit? If they do, make a little note here. Would like to quit smoking. It's one of the services that we don't really spend a whole lot of time doing, but we can get involved or make an appropriate reference to certain program if that's something people want to do. To use controlled substances, what we're talking about here is drugs, uh, both illegal drugs and narcotic substances. They ask, well, it doesn't matter. Well, it's important to know as far as there are certain ones that dry your mouth out, make you more susceptible to decay, and then there are others that can make it so that there are certain types of sedation that we wouldn't want to use. If it's a woman sitting in front of you, and you're pregnant or trying to get pregnant or taking oral contraceptives or nursing, again, that's some of these things be a little bit awkward, and so the the health history part of it is something that you might want to let them just fill out on their own and do, just indicate on the chart, I need you to fill out from here to here. If it's something that you're comfortable with, then just go ahead and do it. As far as the health thing, best way to kind of go through that is just systems. Is your heart okay? Do you have any lung problems? Do you have any intestinal problems? Or just go through and ask these things and tell them to have you stop if they've got any of them. So you can go through things pretty quick. So hit save, and then that's all in there. The other thing is that's very helpful if you'll get things, just make sure that the preferred dentist is right, and that if you'll get that done, that will save us some steps. So there are some other things that but that part can be done, and then they can just be asked to sign things in kind of more of interview format than here, fill out this ream, and we may or may not look at the information. Plus it allows you to kind of key in on those things that are maybe more important to them as you're talking with them about things. So I completely understand there won't always be time to fill that out with the patient and for them, but if we can do that, that would just be one thing that we can increase the level of service, especially with those emergency patients that come in, and especially the dental part. There's a lot of questions there that really are kind of more for a patient that's needing some comprehensive care. I think that's it.